So I would like to start with the question of what does the term physical disability bring to your mind? If anybody want to put that on the chat, please do so. What does the term physical disability bring to your mind? Inability to move independently, you're right. What do we usually think of when we think of physical disabilities? Can't do normal activities, that's correct. Thank you for the input, everybody. I know not everybody's feels comfortable sharing something, but yes, like when we think of physical disabilities, usually think of somebody needing a wheelchair, somebody needing a crutch, somebody enabled to move. But the reality is that a physical disability goes beyond that. That's only what we can see. And that's why we are here today to learn a little more about physical disabilities and understanding them. For this, when it comes to the aging population, the elderly population, as these people ages, the prevalence of physical disability becomes increasingly significant. These disabilities not only affect individuals, their bodies, their health, but also have a broader societal implications. This is environment around people around them. All these are different areas that affect having a physical disability. In this presentation, we are just gonna go over some types of physical disabilities commonly seen in seniors, some of the causes they impact on their daily life, and some strategies for managing and improving their quality of life. It is important and on gaining a deeper understanding of these challenges. And once we learn that, we can work together towards creating more inclusive and supportive environments for older adults with physical disabilities, but also for people in general that suffer or have a condition that makes them physical disabled. Mm, and I'm gonna show you the following video. Let me just, I want to make sure that you guys hear the sound. Right. Okay.
What do you think of when you hear the word disability? Wheelchairs? Seeing eye dogs? Sign language? Do you think about invisible disabilities? Learning disabilities, such as dyslexia? Mental health conditions, like bipolar disorder? Or chronic illnesses, like diabetes? These are all correct thoughts. It's important to understand that there are many different types of disabilities. Some can be seen, and some cannot. It is also essential to understand that societal stereotypes about disabilities can cause barriers to success for a person with a disability. Remember that there is a person who is using a wheelchair to get around, a person who is using their seeing eye dog to navigate the world, a person who is using sign language to communicate. Many of us have been taught that a disability is a limitation and that all people with disabilities want to be cured. We might think that it is the person with the disability who is responsible for making lifestyle changes, and not that it is the world around us that needs to change. But is any of this true? Meet Lily. Lily uses a wheelchair. She rides the bus every day to get to work. But sometimes the lift is broken and she's late. When Lily goes grocery shopping, she has to ask people to help her reach things on the top shelves. Whenever her friends want to go out to dinner, she needs to call ahead to make sure the building has a wheelchair ramp at the entrance and that the bathroom is accessible. Lily recently decided that she wants to move in with her boyfriend, but his building doesn't have an elevator. Lily experiences obstacles because our world was not built for and often does not consider the needs of people with disabilities. This raises a number of questions. Is Lily the problem? Or should all buses have working lifts? Should all grocery stores make sure that their customers can easily shop for what they need? Should all restaurants be wheelchair accessible? And all buildings have elevators? More and more people with disabilities, like Lily, are speaking up about their experiences. They, along with disability advocates, are challenging stereotypes and smashing stigma. They're loudly and proudly advocating for the world to be more inclusive and taking action so that people with disabilities can live free from discrimination. Having a disability does not make you less than. Disability is diversity, and diversity is beautiful. Even if we can't always see it, people with disabilities are all around us, and all of us have a responsibility to make the world more accessible, safe, and equal for people living with disabilities.
All right, from this video, we can learn that not all physical disabilities are visible. There are conditions that affect somebody's cognition, as well as their mental health. And these are considered also physical disabilities as they can limit somebody from living normally or what we consider normal. So it is important to understand that not all disabilities are visible. You might have known or met people that are blind or deaf, and not necessarily you can tell right away that they have that condition, that they have that disability until you actually interact with them. So we at the beginning said that when we think of physical disability, we usually think of somebody with mobility limitations and using wheelchairs and so forth. But this video shows us that not all of that is actually true. We have to consider those that we cannot see. But what is a physical disability? In a more defined term, according to the CDC, a disability is any condition of the body or mind that makes it more difficult for the person with the condition to do certain activities and interact with the world around them. There are many types of disabilities, such as those that affect a person's vision, movement, thinking, remembering, learning, communicating, hearing, mental health, and social relationships. Some disabilities, there are many types of physical disabilities, and we're going to go over some of those. Some disabilities can be related to conditions that are present at birth and may affect functions later in life, including cognition, mobility, vision, hearing, behavior, and other areas. So these are conditions that somebody is born with, and as they should the if symptoms show up since birth and people grow up having them. Some are associated with developmental conditions that become apparent during childhood, and some examples of this can be autism spectrum disorder, as well as attention deficit hyperactivity disorder, which is also known as ADHD. These are some of those examples of conditions that we cannot see, but just because we cannot see them doesn't mean that they don't exist, and they usually appear during the childhood. A child will start showing some symptoms, and after running some proper testing by a physician, it's determined that they have one of like this kind of conditions. There's disabilities that can be related to an injury. This can be traumatic brain injury, a spinal cord injury, and this could be because of an accident, a heart fall, a car accident. It's a injury that was not there, but something happened and now you have it, and this can cause a person to do not walk again. Um, and so forth. Sorry, change slide. Some other disabilities can be associated with a long-standing condition, and one example of that is diabetes, which can cause a disability such as vision loss, nerve damage, or limb loss. Maybe you have known somebody that because of uh, diabetes and not proper care of it, there had to be amputated. So now this causes them a disability, and it was associated with a long-standing conditions, which was diabetes. Some other disabilities are progressive. Um, they can be static, they can be intermittent, and some examples can be muscular dystrophy, as well as limb loss or some forms of multiple sclerosis. These are conditions that progress over time once they have been diagnosed. Sorry. Some other examples of physical disabilities could be cerebral palsy, which is a group of disorders that affect a person's ability to move and maintain balance and posture. And cerebral palsy is most common in childhood physical disability, and is caused by damage to the brain before birth or infancy. Some other conditions I just mentioned muscular dystrophy, which is a group of disorders that cause loss of muscle and mass and weakness. And some symptoms include problems with swallowing or breathing, motion restrictions, joint stiffness, difficulty walking, and organ problems. So those are some of the symptoms with muscular dystrophy. We have a spinal cord injury, which is a serious medical condition that occurs when the axons of nerves running through the spinal cord are disrupted, and this leads to the loss of motor and sensory function below the level of the injury. Spinal cord injury can result in a total or partial impairment of sensory, as I mentioned, and motor functions in the body and limbs. Spina bifida, which is a birth defect that occurs when the spine and spinal cord do not form properly. Other examples of physical disabilities include chronic arthritis, chronic fatigue syndrome, fibromyalgia, stroke, and epilepsy. And other disabilities include impairments that limit other facets of daily living, such as respiratory disorder and blindness and sleep disorders. So those are some types of disabilities that we commonly see on seniors. And the fact about disabilities is that it's part of the human condition. According to the World Health Organization, almost everyone will be temporarily or permanently impaired at some point in life. Uh, Disabilities impact all of us, the community, our health, and the access to care. The graphic or the data that we have is that 1 in 4 adults in the United States have some type of disability. This is 27% of the adult population, which is considered from 18 and all up. But what's the prevalence in older adults? And this is what it's more concerning. The prevalence of disabilities And older adults is very high. A report by Morbidity and Mortality Weekly Report found that disabilities are more common among adults of 65 years of age and older, which is approximately 2 in 5 adults in this age group, which have a disability. So we already went over like 1 in 4 of the total adult population, which include younger people than 65. It's 1 in 4 for the whole population from uh, 18 years old and up. But when it comes to 65 years old and older, this age gap has the highest numbers when it comes to having a disability, which is 2 in 5 adults. And anyone can have a disability, and this can happen or occur at any point in a person's life. Uh, but we see that adults are very it's very common to have a physical disability. What are some common types of physical disabilities in older adults? We can see disabilities that cause mobility impairments, such as difficulty walking, using stairs, or amputation. When it comes to chronic pain, we have people with arthritis, osteoporosis, knee, and back pain. Physical and cognitive function tend to decline with advancing age, increasing the incidence of disabilities related to the walking and movement of a person, self-care, and ability to run a household, all of which may limit older adults' capacities to live independently in the community. Arthritis, osteoporosis, and muscle weakness can make it difficult for older adults to walk, stand, or maintain balance. Some other common physical disabilities that we can see in older adults include sensory impairments, which is the disability of one or more senses, like vision loss, hearing loss, vertigo, as well as neurological impairments such as Parkinson's disease, stroke, Alzheimer's, and dementia. These are conditions that affect the part of the brain, which causes them to not be able to think properly, to follow instructions, and this causes a physical disability. Other common types of physical disabilities are conditions that we usually don't think about being cause for a physical disability, but they are. And that's why it's very important and why doctors, nurses, and people that take care emphasizes on being careful and taking care of your body when you are diagnosed with one of the following conditions, because this leads to a more severe affectations to the body that lead into for a disability. And this include cardiovascular diseases, as well as obesity, diabetes, and COPD, which is chronic obstructive pulmonary disease. These are conditions that, if not cared about properly, they can lead into disability. The disease itself can already make people less active. For example, when somebody has a cardiovascular disease, a problem with the heart, blood pressure issues, a pacemaker, their activity levels go down as they don't want to exercise too much and cause the heart to get tired. And this leads into not moving a lot, not doing proper mobility for your body, and this causes the body to start declining, really. We have obesity. Obesity causes people not to be mobile. They stop being active, they stop taking a walk, they stop being independent, and this leads into the body to decline. The joints, stiffness increases, the weakness increases, and they end up in a point that they're no longer able to do the stuff on their own, require a lot more help, assistance from others, and this already makes them like make have to use a wheelchair, and this is already a physical disability. We have diabetes as well that we already talk about, that which can cause affects the senses, as well as can cause the loss of a limb. And chronic obstructive pulmonary disease, which is a condition that affects the person's lungs. Um, and they require a lot more oxygen. This is because of the how it affects the lungs. So people don't exercise or don't move too much because they start getting out of breath, and they require a lot of them require or they need to be near oxygen tank. So these are other conditions that lead to physical disability. But what are the impacts of having a physical disability? And individuals faces several challenges. We saw that on the video that we watched. The persons that get the physical disability affect their independence in performing ADLs, and as well as IADLs, which are instrumental activities of daily living. Some of these impacts that we can see and be more specific about when it comes to mobility, we already know that it affects their walking, transferring in and out of bed, climbing stairs, as well as self-care. People are no longer able to eat or on their own, dress on their own, go to the toilet on their own, or taking a shower on their own. Their people is no longer able to do household activities like prepare their own meals, go out shopping for food, using a telephone, taking medication, money management, housework, and driving. So these are some of the impacts that somebody with a physical disability sees, and these are some conditions or impacts that we see on elderly people. Elderly individuals also uh, experience social isolation, dependency, and decreased self-esteem, resulting in depression and anxiety. These difficulties that they experience can lead to feeling stress, frustration, and dependency. So it is essential to address these emotional implications to provide holistic care and to support psychological, emotional, and spiritual dimensions. People that start losing some level of independence and they're not as strong as they were before, they can no longer walk as they used to, have the tendency to become social isolated, and the feeling of being depending on on other people makes them feel with a decreased self-esteem. They no longer want to participate in social things. If they're with the family and the family is planning a vacation, they prefer to do not go, thinking that the family needs to carry and help them with a wheelchair, transport them here and there. So they prefer not to participate in that. And some families, like to do not deal with the fact that they have to carry a wheelchair. So they prefer to leave that person, under the care of somebody else. So this leads into frustration, feelings, stress feelings for that person. The declining functional capacities is associated with disabilities isn't the only impact. Despite the progress that individuals often face social barriers, which are relative to accessibility, and which hinder social participation. Some social barriers relative to accessibility is that not all buildings, not all places are adapted for people with some level of physical disability. Some examples could be somebody going to having to go to an appointment. They don't have anybody to take them. They don't have a proper, or the family doesn't have a proper, car to transport somebody with a wheelchair. So they decide not to go because the bus maybe doesn't have enough space for a wheelchair and the family cannot provide with transportation. So that's already a social barrier. Some other people might have gone to the doctor and the building doesn't have automated door or doesn't have a ramp and they're not able to go into the clinic. And I've seen that when I used to provide companionship through San Diego Pace for some of our patients. I was going with them to their appointments, and I encounter a lot of times that some of these clinics don't have automatic access. They don't have the automatic doors. Somebody has to hold it. I can go in and out by myself, but somebody with a wheelchair cannot. So a lot of people that would go on their own, they would have to wait until somebody come around to ask for help. So just imagine how they feel, the isolation that they feel, the dependency that they feel. And these are social barriers that people encounter when it comes to accessibility. But also unmet needs by healthcare. Somebody that has knee pain goes to the doctor seeking for some relief for that pain that they're having in me at that moment. And all they sometimes doctors what they do is they refer you to physical therapy, but the patient might not have gotten the immediate need that they needed. The patient was looking for something to help relieving the pain that was experiencing at that moment. However, all they got was a referral for physical therapy. And physical therapy will help eventually, but at that time, the person only needed a painkiller. So what did they decide to do? They just go back home. They or they go to the pharmacy, nearest pharmacy, and they buy over the counter medication for pain and they self medicate because they were not able to find that need met when they went to the doctor. So it is important to also make those modifications. People as professionals, health professionals, be more empathic and be more, conscious when it comes to how we address some situations, because some of those can lead into other problems. What can we do when it comes to managing physical disabilities? So, the key lies in recognizing the disability, understanding the implications, and taking proactive measures towards managing the disability. Family support, access to assistive technologies, and rehabilitation services are very important when it comes to helping older adults with a physical disability to maintain their dignity, their autonomy, and their engagement with their community. This includes adopting lifestyle home modifications, utilizing assistive devices, physical therapy, occupational therapy, mental health and emotional support, as well as regular health checkups, nutrition considerations, community resources, legal and financial planning, and caregiver support. Living with a physical disability in later life can be very challenging, but with the right support and resources, individuals can have a better quality of life. And we already mentioned that this includes home modifications, but what home modifications can somebody do to support a person with a disability? Well, at home, the installation of grab bars, ramps, bathroom and kitchen modifications are some of the home modifications that somebody can make. Nutritional considerations Of course, proper nutrition for better management of conditions like diabetes and obesity is very important. Physical and occupational therapy, as well as speech therapy interventions, can help improving mobility, as well as it alleviates pain, increases in strength and balance, regain independence, improve cognitive and communication challenges. So, just as we saw in the example before, the doctor would refer the patient to physical therapy for knee pain. The person didn't want that at that time. However, it's important for that person for that patient to understand that, you know, physical disability, I mean, pardon me, physical therapy, sorry, can help to relieve and alleviate that pain, talking about a long term. So, yes, you were not given the medication for pain at that moment, but do not forget about that. Going to that physical therapy evaluation to see what they can do. Somebody that work with physical therapists and occupational therapists, I was able to see with my own eyes, how people would come in a wheelchair because of some back pain, really bad knee pain, and with a little bit of and some treatments of therapy, they were able to not only get rid of that pain, but no longer make use of a wheelchair for a long time. So it is very important that we consider these services that San Isidro pays, San Diego pays offers. Mental health and emotional support is very important. Counseling and emotional support is very beneficial in maintaining a good mental health. And, people start getting depressed, feeling more dependent, the self-esteem goes down. So it is important that they also have that emotional support there. Some assistive devices and technologies that it are beneficial for physical disabilities include mobility aids, and this include all sorts of wheelchairs, walkers, canes, and this can help an older person with limited mobility to regain independence as well as safely navigate around their environment. Sensory aids, which include, of course, hearing aids, magnifiers, and text to speech software, assist those with vision or hearing impairments. So always, try to make use as well of that. If somebody is experiencing some loss in hearing or vision, always talk to the doctor about it so they can be sent to the proper specialist for some evaluation and see if sensory aids will help them. And this can help as well with being more independent and less prone to become disabled. We also have a smart home technologies with like voice control devices. We are familiar with Alexa, motion sensors, and automated lighting help older adults with physical limitations maintain autonomy at home. Somebody that uses a walker to has to go to the bathroom at night, the automated light will turn up once that turn on with the movement of the person. So this prevents, for that person to do extra work like trying to find a turn for the light, which can cause them to have a fall, so these are technologies that we can always make use that are accessible in order to support people with physical disabilities. But also, it's important to have family and caregiver support and know the resources available. Respite care allows caregivers to take a much needed break, whether it's a few hours, a week, or a longer vacation. In home care adult day programs and short-term residential facilities can provide this relief. Workshops and classes can teach caregivers essential skills such as managing medications, providing personal care, and navigating to the healthcare system. These resources empower caregivers to provide better care. Family and caregiver support play an essential role. We all know that in caring for disabled older adults, providing them with the necessary support, providing you guys with an education and resources is crucial to ensure that you guys can effectively care for your loved ones or those that you take care of while maintaining your well-being as well. Respite care services include health aides, companionship services, homemaker services, and of course, respite care, which are things that you can find, services that you can find with San Diego Pace. It's part of the benefits. And we have really good caregivers. You know, we have a really good department and when it comes to home care that provides some level of respite care services. Caregiver education and training. This is this is what includes it's included on that this type of trainings, this type of meetings, presentations like the one that I'm providing right now allows you guys to learn a little bit more about a topic and make use of that information when it comes for you to provide kit for others. Some community resources that there are. Uh, Such as senior centers, social services, government programs, benefits for older adults can be very valuable for older adults with physical disabilities. When it comes to senior centers, we have San Diego PACE centers where people can go do some activities there. They can participate in different type of classes, activities such as um, therapy, maintenance therapy, which is a program, for people to be active for a little bit, do some exercises. And these are very good resources that people should take advantage of them. Exploring community resources and support services provide valuable assistance and opportunities for older adults with physical disabilities and they provide opportunities for social interaction. People go there to the centers and then they can interact with others. They can have mental stimulation and physical activities that will enhance their well-being and quality of their life. So it is very important to take advantage of those resources that they are out there in if you know that somebody that you take care of would benefit of one of this type of resources, always try to look for help, guide them to approach their social workers or so where they can learn more and know more about what resources are there available for them. And as we conclude, I just want to go over the takeaways. And the key takeaways include you now understand that physical disabilities and their impacts in people's life. You have learned that not all disabilities are visible. You have learned the way that physical disabilities can be managed, incorporating some technology and rehabilitation and you learn about resources that make it possible to enhance the well-being and quality of life of older adults living with a physical disabilities. So in conclusion, physical disabilities in older adults are a significant challenge, but with appropriate management and adaptation as well as with the use of assistive technologies and resources, we can empower seniors to maintain their independence and quality of life. So that would be all from me today. If anybody has a question, please put it into the chat and I'm gonna answer. to you.